Hey YouTube, it's Marita and welcome to another edition of the Nurse Lounge. As you see, I'm in my office and I'm doing videos today, and today's topic of this video is Nurse Residency Programs, my thoughts. So if you want to see what I think about Nurse Residency Programs, you need to stay tuned. Welcome back. My name is Dr. Marita P., registered nurse. Been a nurse for 17 years. OBGYN is my specialty. Well, baby nursery is my specialty, and I'm a nurse educator in my office today, as you can see. And today we're going to actually talk about what my thoughts are regarding nurse residency programs. So, in case you didn't know, a nurse residency program is basically a program in which when you get out of school, that you will go work in the hospital. You do get paid for this. And you work, but you are working supervised, being oriented through it with a preceptor. And it's basically a residency program is basically a elongated orientation. And some hospitals do theirs differently. Some hospitals do 6 months. Some hospitals do a year. It just depends on the program. And what you do is you'll rotate through different sites. So you'll rotate or units. You'll go to med surg. You'll go to, telemetry. You go to ICU. You go to OB. You go to different areas of the hospital, and you work there for a while. Maybe a month, maybe a whole schedule, maybe 2 schedules, 2 months. I don't know. That you have to look up or find that out from the hospital. But you go do these and you learn about that area of nursing, and you do that with a nurse. And at the end of your whole rotation, sometimes you get to pick which area you want to work in. I'm not sure if that's true for every facility, or do they pick for you based on what's open, or do they give you a choice based off of what is open in terms of open positions? But that's what a residency program is. It's an excellent way to kind of figure out, yet again, what do I really want to do in terms of nursing. It's an excellent way to be taught what being a nurse is, and some by different people, because when you're rotating through different departments, it's not going to be the same preceptor. So one nurse is not going to follow you the whole 6 months to a year if you're going to different departments. If you're doing a residency program where it's only one department, then that's something different. So be mindful of that. I think this is just a great way for you all to go learn what it is to be a nurse. Now, keep this in mind as well, especially since if you graduated recently and you graduated during a time in which the COVID time, meaning that you probably didn't get a chance to do clinicals, on-site clinicals. Maybe you had to do virtual clinicals, or do a simulation on your campus. That's not the same as on-site clinical, and it definitely doesn't. It helps. It is better than nothing, but it's not the same experience by no means. So if you were in that situation where you, excuse me, if you were in that situation where you did not have that, a nurse residency program is most definitely for you, because that way you won't be thrown out there to do and to take on patients that you're just not ready for, because you don't have not even the basic skill set, because you didn't have those opportunities in nursing school. So I just want to impress the importance of you. If you happen to have a hospital that is offering a nurse residency program, you need to jump on it. Jump on that program. Get all the experience you can get. Make a decision about what you really want to do when you finish the program, and then go and be the best nurse you can be. So hopefully this video helps in terms of people who are like, should I do it or should I not do it? Yes, you should. Now, if your hospital doesn't offer a nurse residency program, or there's not one close by that you can go to and work at that hospital, then what you really need to do then at that point is focus on learning whatever area of nursing that you want to go into, that they will hire you for as a new grad. And with that being said, you need to make sure you're getting at least a good 4 months of orientation, at least 4 months. So 4 to 6, but at least 4. If they try to throw you out there quicker than that and you're not ready, honestly, you need to simply say, this may not be the facility for me. I need more time. You want to protect your license at all costs. Protect the license at all costs. So I think that's pretty much all I want to say about that. Yes to nurse residency programs. If you don't have one, you just heard what I say to do. Make sure you get plenty of orientation. Don't be afraid to walk away from that job if they are not going to provide you the training that you need. So if you don't feel like you're ready, because some of these programs or some of these jobs, I'm not lying, will have you offer orientation in 2 months as a new grad. I've seen it happen. 2 months as a new grad. I had 4 months when I went to school, or when I was a new grad 17 years ago. I had 4 months. And they're just taking away that time. And the thing is, you're not ready. And when you're not ready, you're going to be unsafe, even more unsafe. You won't be completely ready when you get off orientation, even in 6 months. But the point is, you'll be more ready than you were say 2 months. So at least 4 months that you want for orientation, at least 4 months. If they're not offering that, matter of fact, when you go to interview for your job, one of the first questions you need to ask is, how long is the orientation for new grads? Ask that question. See what they say. If they say it's 2 months, don't even take the job. Don't take the job. Do that. I think that'll help you. Ask questions at your interview. Ask questions. All right. Thank you so much for watching this video in entirety. Short, sweet, to the point. Yes, I know. Follow me on live, or not follow me on live, but definitely watch my live. Stay tuned to the community tab to know when I actually go live every week. Here lately it's been Fridays, but it could be Saturdays. We are doing great things over there on live, having a great time with discussions about nursing and nursing concepts and nursing, just nursing life. We're having a blast. Also follow me on IG and TikTok if you choose. And until the next time, you all take care. Bye-bye.